So welcome to our 13th annual Air Quality and Health Workshop here in Vancouver at the Sheraton Vancouver Wall Centre Hotel. I'm sitting here with Dr. Tracey Woodruff, and she's from the University of California, San Francisco. She's been featured in articles on WebMD, as well as articles on USA Today, so it's a humbling experience to get the chance to talk to her really briefly about what she's here to talk to us about, and that's reproductive impacts and as it relates to air pollution. So let's jump right into it.
Okay.
So how does air pollution affect reproduction?
Well, first of all, every pregnant woman in the United States or in the world is exposed to air pollution, whether it's from outdoor sources or indoor sources. And the reason we're really concerned about prenatal exposure to air pollution is pregnancy is a very vulnerable period of development.
Absolutely, yeah.
Right, meaning that there's things that happen only one time, right? You get your DNA from your mom and your dad, they get together, and then that's when your brain forms, that's when your limbs form, all the different features that then grow when you're born, and then when you childhood and adulthood. So we're concerned about exposure to contaminants generally because if you interrupt anything during that time period, you can reprogram the events of development afterwards. And air pollution, we already know it affects adult mortality and adult outcomes and child mortality, but the idea that we could actually also have reproductive health outcomes is something that has been emerging over the research over the last 20 years. So some of the areas that we've looked at is higher exposure and air pollution related to effects on birth weight. So that means as pregnant women get exposed, does she have babies that are born slightly too small or even much too small, smaller than they normally would be if they hadn't been exposed to air pollution? Are babies born too early, what we call preterm birth? Are they born before they're ready? Right? If you have normal gestation, it goes from 37 to 40 weeks of gestation. But what if you're born before that? We have studies that show, just on looking at low birth weight and preterm birth, that those things can affect your risk for health disease throughout your lifespan, whether it's immediately in childhood, such as effects on neurodevelopmental outcomes, or even all the way into adulthood, such as cardiovascular and metabolic disorders. So looking at the air pollution, whatever the effects are in terms of low birth weight and preterm birth, can have lifelong consequences. And what we have been finding in studies throughout the United States, some in Vancouver, others in Canada, and in other places around the world, is that we're seeing that higher levels of air pollution are associated with smaller birth weight babies and babies who are born earlier than they should be.
Okay. So let's take this even a step further back. What about fertility? I mean, as a hopefully soon-to-be father, how does this affect fertility? You
know, that's really interesting. So my area of research is on pregnancy outcomes, but there has been some evaluation of does air pollution affect sperm? And there's some suggestion that that can happen. Does it affect fertility? I think that the research arena around that is less robust. And part of the reason is it's a lot easier to study birth outcomes because when you're born, every baby has a birth certificate.
Of course.
So we can collect all that data and look at the link to air pollution. But people who are struggling with infertility, it takes us a lot different kinds of studies to evaluate. Though it's certainly plausible to be linked because we know that air pollution has systemic effects, meaning it can affect all these different parts of your body. And that it can cause your body, for example, we heard from a talk that it can cause inflammation within your body, which is a general mechanism by which can cause many different types of health outcomes, including reproductive health outcomes like effects on your ability to conceive.
So you sort of touched on this then. What about congenital malformations? Well,
there's been actually quite a number of studies looking at relationship between air pollution and congenital malformations, so birth defects. Most of the studies have not found a relationship to many birth defects, but have had a suggestion that there might be cardiovascular birth defects, particularly in specific structures of the heart in babies that are born. I would say those studies there are less of them, and they suggest that there may be some association, but I would say that it hasn't been definitively shown. But there is definitely some potential for concern there.
Wow. Okay. Well, then, what about our pregnant population that's out there? What would you say to them? What precautions could they take, or is there anything they can really do?
This is such a great question because I work with obstetricians, other doctors, and we've actually been confronted by doctors because if you're pregnant and you're worried about air pollution, this is a tricky one because there's not too many things that a pregnant woman can do about air pollution. And so one of the things, that's why we really are very focused on, you know what, this is the kind of thing that the government needs to deal with, because you as an individual have it's very difficult for you to personally influence your air pollution exposures because you don't have control over whether people are driving their cars or whether the smokestack is emitting air pollution. So what we have been focused on is getting doctors to be engaged in advocating on behalf of their patients to policymakers, because their doctors, obstetricians are really concerned about their patients, and they know that the air pollution can adversely impact the health of their patient, their pregnant patient.
Yes.
And so they have actually been issuing statements recently over the last year and last couple of years saying, we really have to address environmental exposures. We can advise our patients on the best ways to stay healthy, because one of the things you can do when you're pregnant is just to do the things that you would do for a normal healthy pregnancy, like eat a good diet, not get good sleep, avoid smoking and alcohol. And then the doctors can advise their patients to do that while they're also going out and advocating on behalf of their patients to policymakers to reduce those other risk factors.
Absolutely.
Right, that their patients don't have control of.
Yeah. Now, is there a specific period or trimester that is more susceptible or for pregnant women, or is there anything
that's
on
a really good question. That has been something that we in the research community have evaluated. We see an overall effect of when the exposure occurs during pregnancy, that you can have these adverse birth outcomes. It's difficult to pinpoint when exactly it might be more important. And it could be because they're all important for different reasons. So, for example, during the very beginning of pregnancy, when the fertilized egg hits the uterine wall, and one of the first things it does is develop the arteries that become the placenta.
Right.
So air pollution's theories are that could affect that very initial stages of placental development, and we know that can then impact birth outcomes. So that could be one mechanism. That would be the first period of pregnancy. But then there are studies suggesting that the latter part of pregnancy may be important, because air pollution can affect the health of the mother, and her health is important to maintain in order to maintain the growth of the fetus or the baby. So I think, while we don't know if it's clear, it's also clear that if we just reduce exposures overall during pregnancy, we're going to get a benefit for birth.
Yeah, and that's a good thing for everybody, really.
Right.
So that's a fascinating topic. Unfortunately, we're out of time with Dr. Tracey Woodruff, but we will have her deck from her presentation up on our website. So if you want to go into more detail than obviously we were able to go into here, you can download that there. So we want to thank you for doing this.
All right, thank you.
And we'll talk to you guys soon.
All right.